and welcome to the MPGI channel. Don't forget to subscribe so that you don't miss any of our videos. All right, today you're going to listen to Dr. Jennifer Fournier. She's going to discuss her transition from clinic practice to opening her own clinic and independent practice. I think you're going to find it fascinating. If you would like to have this transcript plus the transcripts of other interviews that were completed with people who transitioned from nursing and nurse practitioner roles to other kinds of work, then don't hesitate to go to the npglobalinitiatives.com. So that's Nurse Practitioner Global Initiatives. Go to shop and look for the book called Forging a New Career Path. You can download it for free. All right, without further ado, let's get started.
Hi, everybody, and welcome to our discussion today. Today we have Dr. Jennifer Fournier, who has started a business, and we're hoping to learn more about that from her. So welcome, Jennifer.
Thank you, Roberta.
I'm just wondering if you wouldn't mind describing the business that you have.
Yeah, so I'm located in Northern Ontario, Canada, in a community called Sudbury, in a suburb of there. And I have a clinic that started off really as what we would have called a Botox clinic. I got trained in cosmetic injections some years ago and started offering Botox, and then, got skills in dermal filler. But really what's evolved in this is that it's become more all-encompassing in the sense that I'm a licensed nurse practitioner here in Ontario, and I've landed up doing a lot of clinical skin as well. So diagnosis of skin conditions, prescribing and treatment of conditions of the skin on a private basis, alongside of the more truly cosmetic treatments or enhancements that I started out with in the first place. A lot of acne management. I do some drainage of cysts in the clinic, and manage some skin infections as well.
It's certainly, from a business perspective, really very different from the nurse practitioner role. So just out of curiosity then, what interested you in a business, in organizing a business and starting one?
Yeah, so it's more concept than content for me. I always was interested in nurse practitioner work life, employment. I did some PhD work alongside my business that was centered around satisfaction and people leaving jobs. And what I really found and what I felt, my research really reaffirmed what I felt, was that people are drawn to the nurse practitioner role due to seeking out some autonomy. Sometimes when they get into it, they'll end up seeking even more autonomy. So they realize that they're still an employee in an organizational structure, and so on and so forth. So even though clinically the role is autonomous in terms of decision-making, diagnosis, patient treatment, the employment arrangement most of the time in the traditional format has been that you're still an employee, just like you would be as an RN elsewhere in different phases of your career. And so I wanted to try something that was truly my own, even if it was part-time, just as much for the experience as for the content. So I wanted to try to have a business. I wanted to see what that was like, and I was interested in clinical aesthetics at the outset. So putting all that together, while I was doing research on nurse practitioner working, I was trying something that I thought possibly aligned with some of the satisfaction and dissatisfaction that people felt. And I was right to do so, because I found that having a business is very satisfying. Being truly autonomous administratively as well as clinically is also very satisfying.
That's really interesting. And can you give us some insights into what helped you when you were starting out or just starting up the business?
Yeah, so I started my business in what I would consider to be challenging times for a nurse or nurse practitioner to start a business. So as probably there were a handful before me, but they were in more traditional nursing roles. So I had a friend who ran a home care agency. We have a colleague who runs a governance business and so on. But the aesthetic was into an area of practice that was similar to something that some of the parts of it were similar to services that dermatologists clinics offered, plastic surgeons clinics offered. And at the same time, so there was a feeling of worry about entering the competitive sort of business field in the local area, one, and how that was going to work. And then secondly, our regulatory frameworks didn't have a lot of room or specifics to offer us. And so sometimes when you call for help from your regulatory college or from the insurers that help nurses and nurse practitioners to cover their practices, when you're charting new territory, it's like they didn't always have the answers before you called. Sometimes the answers came afterwards, which is typical of any kind of trailblazing. But you have to be a little more edgy to be able to tolerate being in that position where you're moving forward with something that isn't well standardized among our systems. And sometimes you actually had to become involved in that standardization by articulating the need for policies and regulations and clarification and clarity on the content of the clinical work that you're doing in business, as well as how some of the standards relate to how you operate your business. So it's been a really interesting journey to be sort of early in the field.
It sounds it, and it certainly sounds like you've had to negotiate through some ambiguity at the regulatory level, at the insurance level. I'm just wondering, from a perspective of the actual physical setup and maybe recruitment of clients, how that process played out when you first started.
Yeah, so that was a couple of things. So business administration, even with master's level preparation in health admin, was a big learning curve, going into the quote unquote the local market. And then also trying to figure out what's compliant and what's not. So when you're a licensed professional, the way that you yourself in social media and the way you conduct yourself, as some may be aware, is is there for everyone to see. And there are a whole bunch of sets of standards around advertising. So some of the more stressful things for me were around marketing and what's allowed and not allowed, especially when I'm dealing with a service that involves the use of medications. And so trying to figure out how I could do this in a way that was going to be compliant with my regulator, because I certainly wasn't interested in deviating from that, but couldn't just follow what was already out there, because we were all at varying degrees of in the know in the early days. And so there was always that worry about being in business is more autonomous to begin with. You're kind of on the radar in that way, possibly. And then what if I wasn't sure about something and something wasn't correctly done? So that lack of clarity around all those parts requires a really determined person who's interested in moving forward with something that's not always clear, and that's constantly like a project in motion. And also you need to be able to tolerate a lot of ambiguity. I think the word ambiguity that you used is really important. The interesting thing is that somebody who enjoys full scope practice in a traditional NP role, like we have here in Ontario, so like the government funded type positions, in family practice by its nature, there's a lot of ambiguity. So it positions some of our nurse practitioner colleagues well in pursuing private enterprise, because if they didn't have a tolerance for ambiguity, they already would have specialized within or outside of the system. Ambiguity is like a big feature of employment.
That is interesting. Now, you touched on something that caught my attention, and it was the use of social media. So from sort of an advertisement or presentation kind of point of view with respect to your business, you said, and rightfully so, that you have to be cautious about how you present yourself across the board and not just specifically to the business. Wonder if you might touch on some of that a little bit.
Yeah, of course. So there are now some regulatory documents that support learning around how to do this skillfully, but social media is open to the public, and without you having it open to the public, you can't promote your business, and it is how we spread the word. So my private business and any other private enterprise stuff that I do is always done through social media. You have to be careful about your professional image, I think, in terms of how you conduct yourself, your respect for others, any anything that you might consider engaging in, like, standing behind a cause, you must really understand what's driving that cause. I think, you're wise to be really mindful about how you get involved in commentary on anything political. And then also, I think how you present yourself. So if you're a licensed nursing professional and there's like an expected standard or way that one conducts themselves and presents themselves, when you move into the private sector, I think it's easy to lose sight of that. So that cultural way that we roll, and of course there's room for individual differences, but the respect for client choice, transparency in advertising, being a good ambassador in your community, all of those things continue to be important despite the fact that you've engaged in a for-profit activity within the competitive market environment. So you have the competitive market environment, which and the social media sort of way of spreading the word about the services you offer, but you have to be really careful about the culture and foundations of our profession at the same time in order to represent ourselves well.
I mean, those are certainly things that hold true for nurses and nurse practitioners in any field, but when you represent your own business, it's even more acutely important. So it sounds as if, and you can elaborate, that things have evolved a little bit in your business over time. And I'm wondering if you can talk a little bit about that and maybe some other challenges or positive aspects that you've noticed.
Yeah, so things have really evolved over time. And I think that in my particular business, that's been client driven. So people would come in for Botox injections, which of course is a prescription medication. I really thought that's what I was going to be doing for the next 20 years in my business. And the next thing you know, they have a brown spot they want looked at. There's a prescription that I can offer that takes care of that. And then there's, their teenager has acne, so now they've brought them in. And so patients really took advantage of my role as a nurse practitioner and my expertise there that I gleaned from or brought with me from family practice. And that became a large part of my business. And then the other part of my business that grew and changed was that, but beyond that, I'm also an educator at university. So what happened was once I got into the private clinic, people that I taught clinical things, in their basic NP education were then asking me to teach them the kind of things I was doing in the clinic. And so I landed up taking transferable skills from the public sector, from the university environment, and applying them in private enterprise as a trainer of this clinical skin and cosmetic work that I was into myself anyways.
So you've really built an interesting business and you have a lot of really important insights, but I think it'll be helpful for people to just know if there's any overarching advice or maybe comments that you have for anybody who's interested in starting something.
Yeah, so what I see lately in the field, and I'm always watching because I have an academic interest in nurse and nurse practitioner employment, I'm always kind of watching what people are getting into. A couple of things. One, don't always follow the crowd. I mean, follow them but you do you. So you set up your business the way you want. You work at your business as much time as you want, and everyone's path will be different. Just because there are others in your community that are offering something similar doesn't mean that you don't bring a unique flavor to it. And for most kinds of services, every community needs more than one. So just think of hairstylists and grocery stores and all of these things, there's always more than one. So don't be so worried about that. But also explore unique opportunities for services that aren't delivered in the area where you are, because that'll help you sometimes too. You might find something that's like a niche market that suits you. I would also say, when I say you do you, don't pick something just because others are making money at it or because it's trendy at the moment. Because if it's not you, ultimately you're going to have, when times are tough, or like COVID, for example, or when things are in a dip, or when you have challenges at home, you'll be less likely to persevere at your business. And when you're investing in any kind of business, you're actually investing for the long, medium to long term. So it should never be just a quick buck thing. Like, you're building, evolving, and then your proceeds generally are going to increase as all of that expansion happens of yourself, your mind, your services that you offer, and your reputation. And so I think it should always be long range, and like a good pair of shoes, it should be something that fits you. And it may not be what fits your neighbor, whether you have the license that allows you to do what your neighbor does or not. If it doesn't suit you, it's going to show in the end. So I think that understanding your why, or your sort of foundational values and reasons for starting a business is really essential before you even get into any of the other steps. So clarity in that regard is the foundation.
And that's wonderful advice for any position that you're going to take. I think that's great. So, but I think what you touched on is really important. The things that people may not think about, like their suitability. Yeah, I think those were the key points. The most important thing is finding what you want to do. Thank you very much. This is wonderful. Thank you.